This video will cover beta thalassemia syndromes, which are caused by quantitative defects in beta globin chain production and may lead to red blood cell disease. Let's anchor ourselves. The boat represents beta, and the Thailand flag represents thalassemia. Let's start with that worker. It looks like he works in that mine in the background. He represents beta thalassemia minor. The two red balls next to him represent hemoglobin A2, which in beta thalassemia minor patients is elevated and is typically between 4 to 8%, which is represented by that 6% on his shirt. The baby hang gliding represents delta beta thalassemia because it's shaped like a delta. And this is caused by a deletion of both delta and beta genes. Despite the delta gene deletion, hemoglobin A2 is usually normal. In this disease, however, hemoglobin F will be elevated, typically between 5 to 20%, which is represented by the inscription on the hang glider. Moving on to the bartender who's showing off his signature way of pouring a drink. He calls this maneuver the Le Pour, just like the name of his bar. This represents heterozygous hemoglobin Le Pour, which is a fusion of delta and beta genes. Again, hemoglobin A2 would be expected to be at normal levels, but you'd expect hemoglobin Le Pour to show up as a band in the S region of electrophoresis and comprise about 6 to 15% of total hemoglobin. This is all represented by his apron with the letter S, which will remind us that this hemoglobin appears at the hemoglobin S band region. And since he only makes drinks with an alcohol concentration between 6 to 15%, that will help us remember that hemoglobin Le Pour is expected to comprise 6 to 15% of total hemoglobin. Finally, notice that he's pouring the drink into a delta-shaped glass. You could even say he's performing a fusion. This will help us remember hemoglobin Le Pour is formed by a fusion of the beta and delta genes. Let's look at the last character. It looks like he's a major of some sort. This will remind us of beta thalassemia major, which is caused by two abnormal beta genes. In this disease, hemoglobin F is expected to make up about 50 to 95% of total hemoglobin. He's a baby, so that'll help us remind us we're talking about hemoglobin F. It'll also help us remember that these patients present with severe anemia by the age of 1.